Our presentation is on epilepsy as well as sleep apnea, so to start off, let's talk about what these two conditions actually are. Epilepsy is a seizure disorder. It can often run in the family, but chromosomal disorders or metabolic conditions can also raise the likelihood of seizures. There are three main types, but what they all have in common is that they're caused by abnormal electrical function in the brain. So the first type is tonic-clonic, or grand mal, and it's the most common type. It's characterized by the contraction of abdominal muscles which produce force expiration. The next type is absence or petit mal seizures. This type occurs almost exclusively in childhood between the ages of 3 to 12. The last type is status epilepticus, which is defined as a single seizure that lasts at least 30 minutes or can be recurrent generalized seizures without regaining consciousness between the episodes. This type is a life-threatening medical emergency that can lead to irreversible neurological damage and requires prompt and intensive therapy. Now, with sleep apnea, the condition is a sleep disorder. The most dangerous aspect of this condition is that it relates to one's breathing continuously stopping throughout the night. When it comes to sleep apnea, there are also three main types. Obstructive sleep apnea occurs when the throat muscles relax and block the airway, where central sleep apnea is when the brain does not send proper signals to the muscles that control your breathing. Complex sleep apnea is a mix of both of these.
For epilepsy, there are two main types of seizures, which are tonic-clonic seizures and petit mal seizures. So some commonly prescribed medications for tonic-clonic seizures include lamotrigine, valproic acid, and topiramate. For petit mal seizures, some commonly prescribed medications include phenytoin, carbamazepine, oxcarbazepine, and especially in children, ethosuximide. For sleep apnea, there are two different reasons for commonly prescribed medications, which are wakefulness promoting and aid in sleeping. So, commonly prescribed medications that promote wakefulness include Novagil and Provigil. Commonly prescribed medications that aid in sleeping are barbiturates such as seconal sodium, benzodiazepines such as Halcion, Ativan, and Valium.
Common medication side effects. The most common medication side effects for epilepsy include dizziness, nausea, and fatigue. Lamictal can cause a serious rash called Stevens-Johnson rash, which is a rare and serious disorder of the skin and mucous membranes that starts with flu-like symptoms followed by a painful rash that spreads in blisters. Topamax can cause speech and memory problems, and Dilantin can affect the oral cavity as it can cause gum thickening, thus being at risk for needing surgery to have any excess gums to be removed. The most common medication side effects for sleep apnea include sleepiness, drowsiness, and poor coordination. Modafinil can also cause the serious Stevens-Johnson rash, and lorazepam can be a very dangerous medication to take, as there is a high risk of having hypotension, hypoventilation, and respiratory failure. Medication side effects and dental hygiene care. Some of the medications used for epilepsy and sleep apnea can cause oral side effects such as infection, pain, discomfort, and possible tooth loss. Dental hygienists must recognize these oral conditions in a timely manner and recommend appropriate treatment interventions. It is important that a dental hygienist educates their patients on their medication side effects to help reduce the risks and to combat the side effects already present.
For epilepsy, the conditions and risk factors affecting dental hygiene care are that if a client responds positively to seizures in their health history, further information needs to be obtained from them. Also, postponing care if there's a fear of triggering a seizure in the dental chair. For sleep apnea, the risk factor affecting dental hygiene is that it can lead to cardiac complications which could need medical clearance depending on the specific disease.
Medical alert requiree. Both epilepsy and sleep apnea are considered medical alerts and should be recorded in a patient's dental profile and records. For epilepsy, it is important to determine if it is controlled or uncontrolled. Patients with controlled epilepsy are taking their medication as recommended and have been seizure-free for several months. It is safe for dental professionals to work with controlled epilepsy patients. Patients with uncontrolled epilepsy fail to take their anti-seizure medication, which puts the patient at risk for recurrent seizures. It is not safe for dental professionals to work on these patients' oral cavities, as there is a possibility that this patient could have a seizure in the dental chair. For patients diagnosed with sleep apnea, dental-related stress can cause an acute attack. It is important for dental hygienists to know and be familiar with the risks that could cause a constricted airway in patients with sleep apnea. These patients may not be able to tolerate being in a supine position for dental care, as their airways can become blocked, causing difficulty for them to breathe. It is also important to have an oxygen tank at your side, since continuous oxygen ventilation for nasal cannula may be needed.
If someone has one of these conditions, you would need to ask them follow-up questions to update the medical history, as well as gain a better understanding of their condition specifically. Some questions you should ask a client that has epilepsy is when was the last time they had a seizure, if they're on any medication, or if they've eaten that day. It is important to follow up with the medication questions as well, and ask if they've been having any of the noted side effects, as well as if they've taken that medication that day. Some questions to ask someone with sleep apnea would be if they have any cardiac complications, if they can tolerate being put in a supine position, and to ask the client how they control their signs and symptoms. It is also important to ask whether they have medication as well.
In an emergency situation for epilepsy, some signs and symptoms would include aura, which is a change in taste, smell, or sight, a loss of consciousness, sudden cry, involuntary tonic-clonic muscle contractions, involuntary urination or defecation, altered breathing, and a blank stare. For sleep apnea, the signs and symptoms would be a loss of consciousness, throat muscles relax, shortness of breath, and an abrupt awakening. In an emergency situation for epilepsy, you would first place the client in a supine position, lower the dental chair, and clear the area of any sharp objects. You would avoid flashing the overhead light in the client's eyes. Don't attempt to restrain the client. After convulsion, assess and monitor their airway. You would administer oxygen as needed and provide supportive care. For sleep apnea, if it goes untreated, it can lead to many different health problems, such as cardiac complications. So if someone were to experience a cardiac arrest, it would be an emergency situation, and then what you would do is you would place the client in supine position, you would activate the EMS, and initiate basic life support to them.